want you to think about how much technology has changed our daily lives over the past decade. Today, we can order groceries with DoorDash, attend classes online, work remotely, and communicate with people across the country with just a few taps on our phones. Technology has made our lives easier in countless ways, and healthcare is no exception. Today, patients can schedule virtual doctor's appointments, receive medical advice, and refill prescriptions, and even monitor chronic illnesses without leaving their homes. Just a few decades ago, this seemed impossible. However, telehealth has transformed healthcare by making it faster, convenient, and efficient. In fact, the New England Journal of Medicine explains that telehealth has expanded access to care by allowing patients to receive treatment remotely while reducing many barriers to healthcare. Whether you're healthy or managing a medical condition, that's a good chance. There's a good chance you will use telehealth at some point in your life. So if telehealth health becoming such an important part of healthcare, why shouldn't everyone have equal access to it? To better understand this topic, I researched peer-reviewed medical journals and trusted healthcare organizations, including National Institutes of Health, the New England Journal of Medicine, and JAMA Network Open. Through my research, I found that although telehealth has transformed healthcare for the better, technology barriers and healthcare disparities still prevent millions of people from receiving the care they need. Today, I'll discuss the barriers limiting telehealth access, addressing common arguments against expanding telehealth, and explain what can we do to make it more accessible to everybody. Let's begin by looking at the problem. One of the biggest barriers to telehealth is digital divide. Many rural communities and low-income families simply don't rely on internet or devices needed to connect with healthcare providers online. Research has shown that many Medicare benefit cashiers lack access to computers with high-speed internet, making telehealth much harder to use without reliable internet. Telehealth became a privilege instead of a healthcare resources that's available to everyone. Another challenge is digital literacy, especially among older adults. Many seniors struggle to navigate modern technology, making virtual appointments frustrating or even impossible. Language barriers, disabilities, race, and social economic statuses also made telehealth harder to access. According to a study published in JAMA Network, these factors significantly affect whether patients are able to use telehealth services successfully. Telehealth has incredible potential to improve healthcare, but it cannot fulfill the promises if people who need it most are unable to use it. Finally, healthcare disparities continue to exist, although telehealth has made healthcare more convenient. Underserved countries still experience lower access because social economic barriers and limited internet availability. If these populations continue to be excluded, telehealth will never reach its full potential. Despite these challenges, some people argue that telehealth shouldn't continue expanding. One common argument is that virtual doctor visits aren't as effective as in-person appointments. While that may be true for surgeries or physical examinations, many routine follow-up appointments, prescription management, and counseling was handled very effectively with telehealth. Another argument is that everyone already owns a smartphone, so access shouldn't be a problem. But simply owning a phone doesn't mean someone has reliable internet. No, or access to language support. Millions of Americans still face these barriers every day. Finally, some people believe expanding telehealth costs too much money. However, a report by McKinsey and Company found that telehealth can actually reduce healthcare costs by lowering emergency room visits, reducing transportation expenses, and preventing unnecessary hospital admissions. Expanding isn't just good for patients, it's good for our healthcare system. So what can we do? Imagine a future where every person, regardless of age, income, or where they live, can schedule a doctor's appointment from home without worrying about transportation, internet limitations, or technology barriers. Imagine elderly patients receiving regular checkups without leaving their homes, rural families speaking with specialists hundreds of miles away, and people getting treated earlier before conditions become emergencies. By expanding broadband internet, increasing insurance coverage for telehealth, and providing technology training for patients, this vision can become reality. As students and members of our community, we can help make differences. We can educate our friends and family about telehealth, help help older relatives learn about telehealth, and expand broadband internet insurance coverage and healthcare for healthcare services. Um, Small actions from individuals can create lasting improvements for our communities across the country. To conclude, today we discussed how technology has transformed healthcare through telehealth, the barriers that continue to prevent equal access, and the steps we can take to improve healthcare for everyone. I encourage each of you to support efforts to expand telehealth and help others gain access to this life-changing technology. Healthcare should never depend on where someone lives, how much money they make, or how comfortable they are with technology. I'll leave you with the same thought I started with today. Technology has already changed how we shop, learn, work, and communicate. Now it's changing healthcare. The question is whether telehealth works. It does. It does. The real question is whether we are willing to make sure everyone has the same opportunity to access it. Thank you.